So how we start out every show, besides introducing our esteemed guests, I talk about in medicine, I talk about something called the chief complaint. And so as we're talking about in relation to the show, the chief complaint, for those that don't know it, it's when somebody comes into your office in the medical practice, and that's the reason why they're there. And in the relation to the show, the chief complaint is kind of like the question of the hour, and that's what we're going to talk about today. And so the chief complaint, aka the question of the hour, is what are we doing to best minimize the burden of breast cancer in this country? So we're going to shape some of the conversation about that kind of thing. So without further ado, I'm going to ask my first question to Dr. Gressick, because why not? She's sitting right next to me, so therefore she gets the first question. But but I want to just start out, like, again, we're talking about breaking down some barriers. We're going to get into some of the treatment, the other kind of techniques that are out there. But let's just talk about screening in general. Why is breast cancer screening so important?
Well, a lot of things that we get diagnosed with, you have to just deal with and treat. And in some ways, sometimes patients are stuck dealing with these illnesses for the rest of their life. But for breast cancer, you really have an opportunity to take something, make it go away, and help those patients live the rest of their life disease-free, potentially. And there are very few things in medicine that where we can actually say somebody's disease-free from something. So one of the advantages of screening certainly is that in some cases, we may find this before it's actually invasive cancer. And so when you talk about prevention, directly at its core starts with good mammographic screening. So we're very grateful for good radiologists who are able to pick up on this, but it begins with a woman's conversation with her primary care physician and or gynecologist and actually going in to get the test. So in terms of barriers, that's probably one of the biggest barriers is going to be getting people to come in and actually finding these things before there's something that's too big for us to take care of.
I agree that one of the more frustrating things that I find myself into the situation quite often, and then they wind up seeing you or certainly getting their imaging maybe late in the process, is I might have somebody who comes in for annual physical, and of course one of my tasks as a primary care physician is to make sure we do age-appropriate cancer screening. So I may order the mammogram at that time, maybe they're 40 years old, 41 or whatever. I order the mammogram, or maybe I'll get that story, they might be 50, a new patient, never had a mammogram, and I order the mammogram, and then maybe a year goes by, and I haven't seen the patient back, and then I see him again for maybe another acute issue, and I go, hey, by the way, I ordered that mammogram 8-9 months ago. What happened? Like, you didn't get it done. I don't see any record of you getting it done. And then we finally get it done, and then something bad is on that. So, Dr. Govides, why don't you talk a little bit about, from your perspective, the importance of screening from a radiology standpoint versus, obviously catching things early. But I'm sure you're hearing those kind of stories too, where somebody may delay their screening.
Yeah, it's a very true statement that cancer kills. But with appropriate screening and appropriate screening management, cancer is curable. And breast cancer is especially one of those cancers. When detected at a non-invasive stage, patients don't just survive, they do remarkably well. It is a truly curable disease. So it's very unfortunate that people delay a screening test that certainly is not a pleasant screening test to go through, but it's non-invasive, and it is the gold standard for detecting breast cancer. And although we have all these wonderful advancements, mammography still remains the gold standard for the detection of breast cancer. And it is a simple study to get done. It's covered by insurance. And although there used to be more barriers in place, at Edward Elmhurst, we've done everything we possibly can to remove those barriers, including being able to get a mammogram without an order, getting same-day appointments, same-day results, doing everything to help the process along, make it easier to get the mammogram, and to alleviate anxiety, waiting for a result, waiting for an appointment. Because you cannot underestimate the effect of anxiety on a person's medical decisions.
Oh, wow. Well, that's some clear-cut example of trying to remove some of those barriers by making it much more of an open process and having some access, and making the access issue non-issue. And I think hopefully as we go through, as we continue to try to move the needle, because we know that if you God forbid somebody has cancer, we all know that you want to get it as early as possible because that increases your chances for survival. And by allowing some of these kind of techniques to now take away some of these barriers, now we're talking about moving the numbers.